when Mandy was talking to me for a couple of minutes, she said the main issue that she's having today is in her levator scap area, okay? And so when you talk about it being in that area, are you saying that you're having trouble turning your head, or you just have pain? Okay, and what about in your shoulders? How's that feeling?
Yeah, it's like you, and also over here, like flat area.
Okay.
Or
Carries.
yeah, I've got usually body tension.
Okay. All right, so based on that, and she was going to roll over because normally I start my treatments with people face up, okay? But I do encourage you to go to the place where the person is having the most discomfort and complaining so you can work that area out first. Number one, that addresses the area that they're complaining about, which most people like, you know, that you're paying attention to that. Number two, it gives you a chance to know what you're up against. You know, you may have somebody saying that they've got whatever going on, and it'll take you 5 minutes to get it squared away, or it might take you 45 minutes to get it squared away. If you've been doing everything else, and then you get to that point, and you've only got 5 minutes, you know, you can't really provide a really full treatment that you would like to do. So there's that. And then that gives you a sense of then how much time you have to work with the rest of the areas. Okay? So we're going to start with your face down. And I do use a wiping towel. I think I've mentioned that before. How's that? Is that comfortable?
Yes. Move the full strip a little bit.
Yep.
Thank you.
Okay. And I am going to take my shoes off. Always. Not at the spa. I'm not allowed to at the spa. Whatever. It's just a rule. It's a rule.
The door's closed.
Okay. The first thing I do when somebody's on their stomach in prone position is I start out, and I think I've shown this to you before, but I'll just go through the demonstration so you have it. This is a technique that I learned at a class that I took specifically about treating arthritis. And the guy who gave the class says that if you do this treatment routinely, it will help to alleviate or prevent arthritis in the spine. Now, it does increase circulation by all means, so, you know, if nothing else, it seems to feel nice. People like it, okay? So you go up and down the spine, then you do some compressions. Now, I want you to notice my body mechanics as I'm working, okay? Whenever possible, I am as straight out as I possibly can be, okay? Not having that bend in my wrist. Oh, I'm not, because it's all coming from my legs. It's all coming from my legs. I also try as much as is possible, and it's not always completely possible, but as much as possible, to never have my hands completely off of the person. Once you break that connection, there's an immediate, although they may not be conscious of it, there's an immediate concern. You know, they've been kind of left type of thing. You try and keep a connection all the time. Sometimes you just can't, but, you know, you do the best you can. Now, I meant to show you, point out her legs and the movement of her leg. versus now, you can see that she's getting a movement all the way down to her feet now, which is good. And this is a normal drape that I use. Do you mind any scents in particular?
Mm-hmm.
And it's bilateral? Both? Yeah, okay. As I move, I'm always moving with my hands too. Okay, so the real trick is to become so that your whole body is giving the massage and not just your hands and your arms, okay? Every time I move my hand, my leg is moving. Every time I move this hand, this leg is moving. It just works together. And it doesn't now, I don't even notice it. I don't have to think about it. You are going to have to think about it to start with, though. And you really need to do that. Because if you don't, it's really going to have an effect upon your ability to continue to do massage.
What does it change when you're trying to apply deeper pressure or greater pressure?
How does it change?
Opposed to
I don't think it really does. Not for me. I mean, I might brace myself a little bit more to do it, but I'm just going in deeper as opposed to staying up lighter. Because you should be bending, you should be using your legs, even if you're just doing a very light massage. That all should be a part of it. It doesn't, yeah, it's not different. Well, yeah, I mean, your hands go down in. Possibly. I mean, yeah, I guess. I don't know, I can't get my brain around it right now. I'm just kind of warming up the whole area. But if you notice, when I come up to this area where her levator scap is, I'm kind of doing a bunch of rubbing around and so forth. What I'm trying to get, just as I'm warming up the tissue, is what's going on up here, okay?
Do you think that the face cradle down, or like that?
Yeah.
Yeah, it helps you get in.
I want the neck stretched out as much as possible.
You
The
can
thing
do
when you're up
everyone.
like this, it's like, oh my God,
Yeah.
you know? It doesn't
That
happen.
happens to a lot of people. If you put it straight, you really can't get in there.
The problem is some people, this will be very uncomfortable for them
They might.
because they're so used to having their head back, hyper flexed, that you kind of have to bring it up. And I do have some clients that do that. The other thing that I do routinely is women who are big-breasted, I put a towel across their chest and then lift the face cradle up high so that the head comes right out, and they've got this bolster across their chest that just takes the pressure off of their breasts. It makes it much more comfortable for them. Is pressure okay? Okay. So she's saying levator scap is her problem. And there's definitely prejudice there. Now, what I'm doing right now is I'm doing a cross fiber frictioning right at the superior angle of the scapula, which is the attachment of the levator scap, okay? But you don't need to know that. What you need to know is that right at this bony marking here, whatever it might be, there is all sorts of junk in there that doesn't feel like healthy tissue, okay? And that's what you really need to know, because that's what you want to start breaking down. Oh, it is. It's because we're a society that goes like this and has our arms out, and it's just who we are. So I'm going to do that. What am I spending? Maybe a minute here, and then I'm going to stop, and then I'm going to milk it.
So because it's so
Stretch it out.
tight, you're not gonna get it, you can just go in and work it for 2 or 3 minutes and release it, you gotta do it. Trip from the end of it.
A couple of reasons. Number one, kind of along those same lines, you can stay in an area for so long that somebody just starts to react to it because you're just there for so long. Number two, I'm doing the same technique over and over and over again, which is not good for my hands. So I'm gonna stop and I'm gonna stretch my hands out. Okay, so that's another reason for doing it. So it's a combination of the two. Now, she pointed out that in her teres region was also tight, which is typical. When you've got tightening on this side of the scapula, it tends to pull on the teres side, so I'm just working in here as well. All right. Okay, see where my leg is, see where my arms are, see where my hands are, and see where my thumbs are. Everything is supported. It's in a line so that it's getting the most support that it can while I'm working on it. Now I'm going to go to the head of the table. Do a little run over that supraspinatus and the trapezius just to see how that might be affected as well. Doing a little vibration like this is really good for breaking up that crepitus. Crepitus was an answer on the test. I don't remember what the question was.
Yeah, it was crepitus and vibration, I think, was the choice.
Oh, by the way, I'm so sorry I forgot to go over the medical terminology. I was like, completely blew that one off. Sorry about that. I figured you guys knew it so well. I'm not gonna worry about it.
You told us who's gonna do it.
Oh, yeah. So it's not about doing the same thing over and over and over again. It's about trying out different stuff and seeing how it makes a difference, if it makes a difference, and then going back and doing that a little bit more. Something like this, something like what's going on in her Roberta scap, this is not a one-visit deal. This is she's going to have to come back if she really wants to get this freed up. But we can make some good progress. Okay, now, keeping track of the time, I've already done 10 minutes. And I've really concentrated on the Roberta scap just with a couple of minutes of warm-up. So now I'm going to move over to the other side. I try not to do much more than 10, 15 minutes in one very specific spot. Try and break it up a little bit.
Would you grab the shoulder for that Roberta scap at some point and try to kind of do a little stretching? Rub it out a little.
Yeah,
If this doesn't succeed, then you might put it out.
Yeah, I mean, it depends upon what's happening with it. Right now, with this
Just right there on the
crepitus,
little thing.
it's just not,
So just one break down.
the crepitus needs to get broken up before anything else is really gonna happen, because that's gotta clamp down,
Yeah.
So until you can let that go, break that up, you're not gonna get much further.
We can't feel it from here.
I know.
Maybe those of us who are more sensitive.
Were you using cross fiber?
Hmm?
Were you using cross fiber frictioning?
Yes,
First? Yeah.
yes, and that's what I'm doing right now,
Yeah.
too. And this is a little cross fiber with vibration. This is really tight right here. Is this your worst side?
I thought my left was.
Well, this just feels tighter. And I always tell people that when they say, oh, well, I really feel it more on my other side. It's like, well, that's okay, it's not, the two don't necessarily go hand in hand. What you think is happening and what you feel really doesn't mean a whole hell of a lot compared to what they feel.
Whoa.
Hear it?
Yeah.
Slow, that's slow.
Yeah.
Wow. Amazing. Yeah.
You doing all right with it?
Yeah.
See how much tighter this is? How much more junk is in here? I do a lot of kind of rolling like this at the trapezius. Yeah, this is all done up in here.
Not for long.
I find vibration is one of the best things that you can do as you do your strokes. You go in deep and then just vibrate it through. It's amazing what breaks up when you do that.
I think it tricks the brain.
Yeah, I don't know. Well, it obviously does something to the muscle spindles, tells them to relax. Because you're not on the Golgi tendon, so, yeah. When I do necks, it's practically all I use is vibration. It's just. Okay, now, levator scap goes up into the neck, okay? It attaches up at, C, 2, 3, 4, 5? 1, 2, 3, 4? Somewhere up there. So I go up and check to see, is that sensitive?
Yeah.
Yeah. Okay, so that's like right behind the ear here. I just want to pay attention to that end of things too. And this is that whole concept that just because she's complaining down here doesn't mean that there aren't other areas that you need to attend to.
More sensitive like that.
Yeah, than the other side?
Yeah.
Now, all I'm doing right now is I'm holding on the attachment point. I'm not holding very hard at all. And I'm just rocking her head.
Does it hurt, maybe? It feels like it hurts.
It's tight, so it's uncomfortable.
Do you feel it loosening?
Yeah.
Now, see, I'll get into more of that when I get her face up, because I do want my neck work face up.
Do you work with everything?
Oh, yeah.
The typical Swedish massage don't recommend the shape or vibrate your finger when you touch the body. Okay?
You shouldn't touch?
No,
You should.
it's tough, but it don't recommend you to vibrate and like this, or like this. That's the whole push.
Well, all of the above is true. You know, you push, you hold, you vibrate, you maneuver, you do also, you know, it's not one thing. It's not one thing. It's a lot of different things. Okay? All right.
But you do recommend vibration.
Oh, yeah, I think vibration is excellent. Yeah.
Someone told me in Sweden, yes, in typical Swedish massage, do not loud off the
Well,
vibrate.
okay. Let's get some definitions here. Swedish massage is a relaxation, long strokes, long effleurage strokes, big petrissage movements, things like that. Vibration has no place in that style, okay? But that doesn't mean that vibration isn't a very valid treatment option, okay?
Cool.
Yeah. So you got to distinguish between the type, like if they're talking about a particular type, like a Swedish massage wouldn't include that.
It's not their intention, right?
Right.
It comes down to intention.
Exactly,
Yeah.
intention,
Yeah.
very good. Okay. So I'm going to have you lift your arm, I'm doing this myofascial treatment, go ahead. Yeah. Because I'm doing this myofascial treatment at the end of my work with her. That was good, huh? Very good. I'm using a cloth so that I can get nice traction. One of the other things I just want to show you about the cloth that you can do that really helps when you need to get in to an area is you put your cloth on the place that you want to work or below the place where you want to work, and then you stretch it out, and now you can get in there really nicely. Elbow, whatever. So, having a wiping cloth is very helpful.
I usually just use the sheet.
Yeah, you could do that. You could do that.
Plus I have long sleeve shirt.
I hope you're rolling it up. You don't want to get your sleeves in the oil. It's just like people with long hair not putting their hair back when they do massage, and it's like, you know, did you realize you just like went through their oil with your hair? Not very professional. Okay, so I'm just spending a couple of minutes in the low back just to say I've been there. Okay, and now I'm looking at, I've done 20 minutes, I've got 40 minutes left to finish off the massage. Okay, to give a full relaxation massage.
So normally we start face up, but this time we start face down because our primary complaint was on
Yep.
So did you proceed to complete the back before?
Absolutely. Yep. I'm just starting from where
Is it yours?
she started. You know, she had me start, so she wanted me to start where I felt it was appropriate to start with the latest steps, and now I'm just going to run the treatment from there. And I suggest that you do that, you know, to just save time.
You never really know what they asked for.
Right.
They don't sleep.
I always do a little rocking before I uncover the legs, just to let them know I'm there. I do drape high. Bruce? Got it. Thank you. Now, this is another thing I want you to notice. I am constantly moving as I'm doing. I'm not standing there doing this, okay? Because that means my arms are doing all the work, okay? And if I have to go in deeper, I just, I guess I do lunge a little bit deeper.
Does that feel deep, Maggie?
No.
No.
These are just some fascia lines, you know, we talked about running those lines up just to feel if there's anything going on. And
It's
she's
like
not-
helping you with pressure too, because you have one hand on top of the next.
Yeah.
That's another good way.
I am
deeper.
appalled when I see you guys stand there like this.
Yeah.
I am just appalled. I can't believe that you don't use both hands all the time. That just, I'm like, oh my God.
Well, no.
Oh my God! But we'll get to that when we get to body mechanics.
When are we getting that?
Body mechanics are towards the end.
You should really start with
Yeah, you should really start with everything.
Yeah.
I mean, think about it, you know? Really. I've thought about that so many times. It's like, yeah, well, we really should start with this, or we really should start with that. And it's like, yeah, you know, everything needs to be started with. So we just got to take it one step at a time and get there. Mm-hmm. Right now, I've just spent 20 minutes of her massage doing the areas that she wanted me to work on. If I felt an area needed some more work, I'd be talking to her about it and say, you know, this IT band is feeling kind of tight. Do you want me to spend some time on it? You know, I wouldn't just do it. I'd check in with her on it. Because, again, the agreement that we had was that I was going to work on her levator scap area, and then I was going to give her a full body treatment, you know. If I'm going to deviate from that, I need to get her blessing to say that that's okay.
Say her complaint.
Uh-huh. Well, there's a lot. Okay, I'm not going to... Okay. There's a lot of different things that you can do, just like there's a lot of different things that you can do in the rest of the body. It just, you know, depends upon what you're going after, what you're trying to accomplish. The same frictioning, you know, if you need to do some type of myofascial work, or I don't really know any myofascial moves on the legs. It's basically, yeah, just a lot of cross-fiber stuff. Something I'm always doing when I'm doing the effleurages is I'm feeling under the tissue to see what's there. So if she was complaining that she was having some type of trouble with, say, her hamstring, I'd be, as I'm going up here, I'd be checking to see where there might be some restrictions or something of that nature. And I may or may not feel something, you know, it doesn't always reveal itself. But if I didn't feel anything and she was complaining that her hamstrings were bothering her, I'd go immediately to working on the Golgi tendons. That's the first step that I use, because I find I get the best results from that. And that would mean that I would, so Golgi tendons, if we're dealing with the hamstring, I got to go below the knee, so I'd be going in here and just doing some loosening as far as the tendinous attachments in there. If she had any sensitivity there, you know, I'd be checking in with her. Is that sensitive? If it is, then I'd be working that area with more detail. And then the ischial tuberosity up here, just raking that. Again, if she's sensitive to that, I just work on that much more.
Would you try to do both things at the same time?
If I needed to do, if I was going to do O and I's, yeah. Now, if her hamstrings were really, really tight and really contracted, then yeah, I would probably do some O and I's on it.
You wouldn't try to hit both Golgi tendons at the same time, both ends? After you got in there and really dug with both ends, did you try to connect the two ends at the same time? No.
Me personally, that doesn't appeal to me, but that's not wrong. You know, it would certainly be an okay thing to do. You know, if that feels like what you feel would be a good thing to do, that's perfectly okay.
Where's the attachment part down for the in this one?
Just down,
There,
just
on both sides?
Yeah, on both sides. Yep, they're both coming down on both sides here.
Is it a light pressure on the Golgi tendon?
No, deeper pressure. Deeper pressure on that.
So where would it be then when you're
Right, and you can see the blood vascularity right through there, and there's a
Right where you bend your knee,
right, exactly, right. That's what you want to stay with.
You can feel it in there. It doesn't feel like...
It doesn't feel like you want to be messing around in there. Definitely doesn't feel like you want to be messing around.
It ain't right.
Okay, my dear, you want to turn over and slide down? turn the lights out? Would that be good? Or you want this over your face? Come close.
No, that's fine.
Is that okay?
Yeah.
All right. How you doing so far? Of course, I forgot to put the somber on your back, but I'll get to that.
Okay.
Why do I keep losing it?
Is it this?
No, it's this. Oh, my teaching also is that you always go clockwise around the body, so that's why I'm starting this way and working my way around.
Do you start on the right or the looser side or any of that stuff?
Just the clockwise, just go. I don't know whether it's right. Is this right? Is this left? This is left, right?
Left.
And this is, yeah, okay. I go left to right. Yeah.
Plus the person's left, yeah.
Particularly with massage therapists, you want to definitely work into their hands. This anatomical snuff box is very painful for a lot of people. It's really good to kind of break that up.
Is that what it's called?
The anatomical snuff box, yeah. That's the technical term.
Isn't the order you typically give this one, isn't it?
Yeah.
I don't think there was an English person who came up with that one.
Now, when I'm doing the arms, I do run my thumb up, because it's a smaller area, so I do run in between the tendons, mainly looking for stuff going on down here, which feels pretty good for you. Yeah, you've been working on it.
We spent lunchtime working at
I'll
Tom's
look at
arms.
that.
Three of us.
Oh, all right, okay.
Working lunchtime.
It's like, wow, that's better than I remember it.
That was Papa's arm. He did the gel outside.
And I want to make sure that I've got some time. We just did a half an hour now. And I have to pay close attention to the clock, because if I don't, I'm just a space cadet. So I really do, I segment it off and know what I'm doing. I do want to make sure that I've got time to be able to work on her neck, because that's where the attachments for the liver scap are. I want to be able to go back to that.
We did find some using glass fiber.
Mm-hmm, yep.
With vibration.
With vibration, yeah, yeah.
Don't, I mean, the muscles in your arms can be tight, and you don't have to have it loosen.
That's right,
So,
Yeah.
you know, Joe, like I worked on a people,
yeah.
and I can tell now work with my own arm. I couldn't work before because I was working.
Well, you didn't have enough comparison, yeah,
Yeah.
yeah, exactly. I like to do a rotation of the legs, see how tight the hips are. So, I had a lady in the spa yesterday who was getting a mani-pedi this is one of their brilliant scheduling regimes, before she comes and gets a massage, like immediately before. So, okay, that's bad enough. But then the woman doing the pedicure just, it is slow. She just, it takes her a lot longer to do the treatment than the time allotted. So she wound up being a half an hour late for her massage. Now, if it was her fault, I don't care. You know, you get a half an hour, that's it. But it wasn't her fault. It was our fault, you know? And I don't think that's right. Huh?
I was gonna say, it's always one place, I don't think schedules.
Oh, where do you get out working in that type of industry? You know, they don't care. Receptionists don't care. They just want to be able to text on their phones or do whatever. They really aren't interested. They really aren't. So, I mean, you find that in a lot of industries. But anyway, so myself and the woman who was kind of running the front desk kind of talked about it, and I said, well, you know, I'll go to the full-time. She's supposed to finish at 3 o'clock, and then I had a couples massage with another massage therapist at 3:15. I said, well, I'm just going to go to 3:15. Tell the other massage therapist when she gets back that we're going to be running a couple minutes late. So we can at least get her 45 minutes. So the woman comes in, and she says, what time is it? I said, oh, it's about 2:15, I think. So she's like, oh, you know, I really need to be out of here by 3 o'clock. I said, oh, okay, well, I can give you a good massage in 45 minutes, which was actually a half an hour. So I gave her this massage in a half an hour. She was thrilled. So that, and the reason why I'm sharing that with you is because that's the point you get to when you do this over and over and over again. You just run through it, it's smooth, and there's just, you just whip right through.
I can see how much ground you're covering now, you realize it's full.
Yeah, oh yeah, it's very, very complete. Very complete. So yeah, and she thought she got a 45-minute massage. It was okay. No harm done. But you'll find you have to start playing those kind of games and kind of improvising and, you know, see how fast you can dance and what you can do differently when you start working at a place, because they, you know, things don't always run smoothly. The spa that I work at is particularly bad. They just are really a very inept group of people, unfortunately. Not all of them. There's really some good people there. Always go around the malleoli, that's the ankle bones. Yeah, it typically does. And you'll feel all sorts of stuff in here. When I first started practicing, it was like every person would be like, oh, did you sprain your ankle? And they were like, yeah. I was like, yeah, didn't everybody?
What did you do when the body is in a weird position where you cannot access? Do you move it or?
There you go.
Yeah.
That's it.
Sometimes people, when they turn over, their foot just turns in weird direction.
Yep, just move them.
We were told not to move it, but to work at it as the natural position.
Your body is weird.
Yeah.
If you can't move them into a position where you've got proper body mechanics, you don't work on that area. That's my opinion. You gotta preserve yourself. So in the knee, we get around, I work all of the different tendinous areas. I love this stroke. This gets right up into the adductors. So if somebody's having issues with them, you can look right in there.
Which is the part that helps the adductors?
That stretch that I was doing up the leg, right in here is where the adductors are. So. Your groin muscle is coming down from here right down into here and attaching right here. So
Ooh.
that's where you, sore?
Yeah, right there.
Right there.
Right there, exactly. Oh my God.
any issues?
You wanna talk about it?
All right, we'll stay there for a minute.
Is there an area in there that you can release when somebody can't move their hips properly? Like my husband's one hip he can completely lay, bend his leg and things like that, but the other side is locked. He said one time a physical therapist as well as a massage therapist did some move and released the hip so it could move out. There's nothing in there
I
that
don't know that there's one, I mean,
yeah. Well, maybe there's more than one move, but like that hip.
it sounds like the
doesn't move
adductors are
Yeah.
shrunk, you
Yeah,
know,
I was thinking it was an adductor
contracted.
thing. It just doesn't, he doesn't have as much movement in one hip at all.
Yeah.
But he had a physical therapist who she used to do something, and he's like completely released it, but it just locks up again.
Yeah,
It's something I want to learn so I can.
probably some type of mobilization
It's something with the adductors.
right in here, really painful in there, huh?
But you haven't had somebody like that who's had a problem with it.
Well, yeah, I mean, I've had people who have problems like that, and I work the adductors,
Right,
you know,
so maybe
to
just
help to
working the
release them.
adductors might release
Is,
it.
yeah. Okay with that? Is that softened up now, you're all right? Oh. Thanks going on right in here, yeah. So see, this, to answer your question, now I'm working deeper into this, but I don't really feel as though I'm doing anything dramatically different with my, with my body stance or anything.
Maybe it's a little bit.
Maybe.
Something like the phone,
Yeah.
you just imagine that,
How's that?
Yeah.
Really?
Yeah, it's,
Can you feel it in there when she was saying what she was saying?
Yeah, no, there's definitely some contracted tissue there. That feeling better? Or is it still really stinging?
All these special techniques, are these things that you've picked up over the years from different like workshops and classes, or because we're obviously learning a routine and then you're giving us other parts.
Yeah.
But like you just pick them up along the way. You
Yeah.
have problems and you start to study them more.
Exactly. And you say, oh, that workshop looks like it would give me good information,
Yeah.
and I'm gonna go take that,
Right.
you know?
It seems like we're really gonna need this if we're gonna want to work people with injuries.
Oh,
What
yeah.
you've been given already is not enough. Or maybe it's just a
No,
built-in.
what you've been given is a foundation.
Right.
And
build on it.
that's, and it's a foundation that if you're going to do generalized massage is all you need.
Right.
But if you want to do more, yeah, you have to take it. There's a lot more training to do. And then you start leaning off in one direction or another, you know?
Find your specialty.
How you doing with that?
really
Okay. All right, if she had said it was still really bothering her, I said, well, I've really got to move on if I'm going to complete the full body massage. Or I can continue to work on it if you prefer, you know?
That was the right answer.
Well, no, it doesn't matter,
Well,
one
for
way
us
or
it
the other.
is.
It's just, she needs to know that if I'm going to stay with it, I'm going to
Well, you
sacrifice
have
the
to
rest
need
of the
something,
body.
yeah.
Yeah. What was that? Did you have a question? Let me know when you
Oh,
remember.
do you check in like almost every massage? You find yourself checking in or just like
For,
like just to keep communication open, like with regular massage, check in and give them the hour.
somebody who's fairly new to me, and I don't know what their tolerance level typically is, then I will be checking in just to see how the pressure is and how they're feeling with it, how they're doing, if they're doing okay type of thing. Other than that, I mean, half my clients and I talk to the massage, we just have a whole little conversation going on. I know everything in their life, everything in my life. How it works. But when you work with people for that many years, it's kind of, they come to my house, and it kind of becomes a relationship. I'm sorry?
And I'm just curious, as when we're working on muscles, we're doing sometimes to treat an area, but doing the cross-fiber friction. But if the tendons are the problem, does it help go across the tendon the same way?
Sure.
Yeah,
You
same
can have
thing.
adhesions in the
Like,
tendons.
a lot of that going on in your arms sometimes.
Absolutely.
Keep crossing over them too, same helpful.
Absolutely,
Okay.
absolutely. Yeah, it's, any of those areas it's appropriate to go into, really. Yep.
I like the circular toe technique and then slide your thumb up the tongue and that.
Yeah, it's kind of a nice little, gets the whole area, yeah.
Quickly too.
Yeah, it's very efficient. I have to admit, I think this routine, which is virtually how I learned it 20 years ago, virtually, I'm still doing the same thing because it works so well. It's just efficient, you get everything nice and neatly, boom, 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 right through the whole thing.
Thanks.
I'll be up on YouTube tomorrow, Randy. Let's see how many hits we get.
Tomorrow, what are you thinking, about 20 minutes?
How many likes on Facebook will we get?
We're gonna put some advertising.
Yeah, good idea. What are we advertising?
The massage school.
Yes, there you go. Oh, yeah, Alexi will be so mad.
Yeah. So Pablo talked about everybody being nice if, the thing was on video for the
Yes.
routine that we have to know.
We said
Like,
that to do.
you didn't like,
No, he
that's
didn't like
really,
it.
oh my God.
Lateral or medial?
Media.
Yeah. That was where it was on the other foot, the leg too, right? Wasn't it the medial attachment down there?
Yeah.
In biking?
Which muscle? Okay, it was,
Well, it's one of the quads.
Oh.
Well, it could be the gracilis. Could be the gracilis. Could be the sartorius. They're all kind of right in there. That's my high level of kinesiology that I have, kind of in there.
Is it common for carpeters to be just above the knee?
Yes.
Sometimes
Yeah.
they feel.
Yeah. Hmm? This is on the sensitive too, huh? Yeah. Hmm. So are you doing anything active in the past week or so?
I'm in swimming, right?
Swimming, yeah.
Right? Yeah.
Nope, do it. Oh, quads, right, extending. Yeah. Yeah. I'll try and spend a little bit of time with someone when an area is sore on them, to try and figure out what it might be, try and remember back. Number one, I do that because I'm curious, why is that sore? So maybe it's something that they do on a regular basis that you should know about. Number two, they should know, because then they get a connection into what's happening with their body when they're doing something.
Their responsibility.
Exactly,
Yes, to make it
exactly. And I think that's very helpful. Because people don't know. People don't have that connection with their bodies a lot of the time.
They
So
make
to
feel
be
that
able to-
something happens then, not that they cause it to happen to themselves.
Right, right.
Didn't you go already through that thing?
Did I what?
Go through that neck?
No.
The back though.
Huh?
Thinks you're doing something to it.
But I don't think you are doing it twice.
Oh, I'm just finishing up. I do have garage at the end of the limb.
Parasympathetic response, I know.
The parasympathetic,
Yeah.
definitely.
If they're watching.
People feel snoring, huh? Now, see, because we ran into those issues with her legs, I'm down to just 10 minutes to being able to, because the arm doesn't take very long, to being able to work on her neck and her face. So, I'm going to have to make some decisions as to what I'm going to do as far as that's concerned. I'm not going to be able to do as much as I probably would like to do, as I'm anticipating I would want to do. But what are you going to do?
Did you do everybody's face?
Can I?
Didn't you?
Yeah, as long as they're okay with it. No, the only time I ask them is at the spa if they're having a facial, then I don't do their face because it's redundant and it's, especially if they already had a facial, I don't want to be putting on crappy massage oil, not oil, but cream, after they just had all these really nice, products put on them.
People don't come to you after their hair is done, right? Is it a hair salon too?
Yeah, yeah.
So they really come to you after for their hair
They don't
style?
include,
or-
the reason why we get the mani-pedis or the facials is because she runs all these Groupons and travel zoos and living socials and so forth, and it's like a two-for deal,
Okay.
So you get a facial and a massage, or a mani-pedi and a massage, She doesn't do the hair with that, because they don't have many, hair people, so.
Do a day maybe, so they do a hair, cutting, facial,
Yeah.
massage,
Yeah.
and spend the day.
Very wealthy. You have to be very wealthy.
How did you get a Groupon? It's only $49. It's a deal, I get my big 17.
I didn't know how it works. I didn't know what a coupon is. I've heard the name, but I didn't know what it is. How'd you get it?
They go online, they come up all the time, I get stuff Groupon, and there's one other that I
Did
get.
this Travel Zoo, Living Social, yeah.
Living Social's the other one that always, for dinners.
Oh, all right.
And I know that I could do that on
Yeah.
myself.
Yeah, yeah. Yeah, I have a nice little tightness in here. coupons, you know, I have a really bad taste in my mouth for coupons because they do, basically what she does is she offers $200 worth of services for $99. So we get $49.50 per treatment, and our 35% cut is $17. So we get a $17 treatment rather than a $35 treatment. And a lot of people don't realize or don't care that that they should be tipping on the full amount, so you get like $5 tip. But are you kidding me? Are you kidding me? It's really, and it's hard, you know, it's really hard to kind of maintain a space of, I want to give the best massage possible when I know that you're going to like rip me off and really piss me off. But what are you going to do?
It's your expenses to go along with that place you work in.
Well, you really have no choice. If you want to work there, you have to take the Groupons. And I, you know, some people just really annoy me because of their attitude, you know, and so I might not give them my best massage, but I try and get a decent massage no matter what. It's just, and I always inform people, if anybody gets even close to the subject of, oh, I got this great deal, it's like, yeah, not so much for me. Really? And really, people are shocked. They're like, you mean you're taking half the hit on this? Oh yeah. Oh yeah. Yeah.
There's people as you like when they go to the massage and you won't like yourself, can you take them to your business? Is that like something that's allowed?
I have told people, well, when people ask me, you know, when am I at the spot? Like, when can I come back and see us? It was, I'm only here, you know, 2 to 8 on Saturdays. That's the only time I work. Well, do you work anywhere else? I said, yeah, I have my practice out of my house. And they said, well, do you have a card? I said, no, I don't have my cards because I'm working at the spot, you know. But, you know, I'm in Rentham looking up. So if they want to, then, and I feel that's a proper thing to do, because then if they want to take the initiative to look me up and find out where I am, then so be it, you know. I've had a couple of people, mainly people who want to start coming on a regular basis, because, you know, it's $100 a massage there, and if you do deep tissue, it's $120. So, plus a 20% tip, you know, I'm charging $120, no tip. For an hour and a half for, what?
If you do cupping, which helps you, you know, when that be considered deep tissue, then you can get in deeper, but you're not
Yeah.
necessarily straining yourself.
Yeah, absolutely.
So
Absolutely.
you're kind of getting away with something.
Yeah, but I don't differentiate between deep tissue or regular massage at my place.
What are you doing with products holding her? Are you just holding?
Just in the super spectators. Oh, I'm holding over on this side and I'm working on this side. Might be the trapezius. I think it's a super spectators actually. Yeah, I decided a long time ago that I wasn't going to differentiate my rates because it gets, and we run into it in the spa. It's like, well, you know, somebody will be like, well, can you really work on that shoulder? Well, no, you bought a relaxation massage. And it's, oh, you can't work into my shoulder? I'm like, well, no. I can, if you want to pay the extra $20. Oh, it just, you know, so I just,
It's all time, right, isn't it?
I'm money.
Yeah. So, I mean, if you just decide you're not going to differentiate, you're spending the same amount of time just doing something different.
Exactly. And the way I figure it is the people who I do the deep work on are the ones who come back and become really regular, much more regular clients, so I make up for it that way. That's just the way I figure it out. So when you're working on the neck, it's tricky because you can really screw up your position of your hand very easily. So you want to keep the hand as straight as possible. the neck, you drop your speed down when you work effectively on the neck to about a half to a quarter of the speed that you would normally do on the body. It's very slow, very respectful.
And slower still on the head when you do the sutures and stuff?
Yeah. Very slow.
Even slower than the neck.
Yeah. It's just important to really respect that area, and also to not promote any type of a headache or anything. You know, I think I told you that the woman who I had, it was just whipping my head back and forth, and I was just like, oh my God, you're killing me there.
Yeah, I don't like that when you're TV when you
Go back and forth. I don't go back and forth.
I had to complain to my why are you turning your head so much?
Yeah, it's not relaxing.
No, it's not relaxing.
Roxy's routine seemed to me, I never liked it that much on this one, so much more mechanical
This is a
and
physical
technical. And whereas with moving everything, it's so much more effective if you really want to get in, you know, let's do it and then let's spend some time.
Right.
Instead of like so much technical stuff that
Yeah.
it's hard to actually treat the body.
Well, it's just
Unless you want to just
where
do it
his
and you're done.
orientation is
Yeah.
coming from, you know? And some people really do gravitate towards that mechanical.
Because then you just do it and that's it. It's cool. Yeah.
And it's just, you know, it's neat and
Yeah.
clean as far as they're concerned. That's just not your style, so that's why it doesn't fit for you. But it can be,
I'm glad that I had to learn. It was really cool. You know, it was cool.
yep.
I don't regret it.
Yep. Yeah, you know, well, it gives you, gives you some strokes to create your foundation with, and then you go off and do something, you know, creative, and you make up your own routine.
Yeah.
I do tend to do one side and then the other, but I move around on that side. I'll kind of go forward for a while, work backwards for a while. And also because it's much slower, the work is much slower, you don't have to move around as much.
How long would you typically do within a routine? How long would you like it?
If somebody's got any type of neck issues, I like to spend 20 minutes on the neck.
Which is where you usually start, right?
Yes.
Look at that, man. Just going to the zone now.
All right, my dear.
So in a normal massage, you would
Just going to press down into the first rib. Nice and slow. In and out, nice and slow. And then into the second rib. That's where those scalings attach. Wow. All right, my dear. That's all we got time for. And that's basically what I say, you know? That's all we have time for. Sorry.
like, all right,
Did the most we could.
you're all set.
No, I would say something like, and your neck really needs a whole session on
You
its
should
own.
really come
you
back
know.
next week.
You should.
Do you want to
Should
buy
get that
10
worked on next
sessions
week.
right now?
No, I wouldn't do that right at that moment, but.
So usually in your standard, you would start with your face and then do that next time, and then dog. That looks really good.
How you doing?
Yeah.
Okay,
Next
so-
class tomorrow, she'll still be there.
Yeah, right.
We'll just bring a straw for you. We'll leave it to them.